¿Qué tal? Muy buena y grande sea la bienvenida para todos ustedes. Hoy vamos a platicar de un excelente proyecto que tiene Doctors Galaxy, que es este programa de acreditación que, pues, francamente me resultó bastante sorprendente, sobre todo lo que abarca. Y es justamente llevar a todos nosotros, los profesionales sanitarios, nuestros centros, nuestros hospitales, hacia justo esa calidad que buscamos tanto en la atención clínica como en nuestra educación continua. Y dentro de los muchos beneficios que tiene este programa es justo el poder apoyar a quienes más nos interesa, que son nuestros pacientes. Dentro de lo cual, pues hay un punto muy relevante, que este programa busca justamente poder ayudar sobre todo a estos pacientes que más lo necesitan. Pero adicional a esto, nos va a permitir estar pues en la vanguardia, tener justo los lineamientos estandarizados que nos permitan estar al día, de acuerdo a justo todo eso que forma parte de la operatividad de la Joint Commission International, de manera que va a ser un vehículo para certificarnos como expertos en nuestro campo de acción. Así que a continuación, pues vamos a hablar con Srini. A warm welcome to you, Srini. Thank you for being here. I'm going to ask you, Srini, some questions that I think could be very interesting to understand deeper what is the impact of this kind of program. Please, Rini, can you explain us what is the intention of this program to support the patient?
Oh, sure. Thank you, Juan. Compassionate care is one of the components which we are targeting through our accreditation program. We want to encourage all the healthcare professionals and all the healthcare provide the perk bonus, be little more compassionate and generous with the consumers so that the unmet needs of the patients can be met. Otherwise, most of the patients do not have insurance and they cannot afford it out of pocket. So if they can be a little more compassionate by issuing coupons, because here in our system, Doctors Galaxy, doctors, healthcare providers, pharmacies, or any product owners or any service providers can issue coupons on their behalf with a certain value of a discount with a certain expiry date, so that interested consumers can avail them with that respective provider or healthcare professional. In that way, example, a doctor maybe can do, example, he's doing 100 consultancies a week. Maybe he can do like 3 or 4 consultancies on coupons that can be helpful to the people who are really in need of those situation. So in that way, we are encouraging the compassionate care through coupons. And the same thing can be done by pharmacies. And the pharmacies are anyhow doing. It's not new. If we can see that all the pharmacies almost have certain kind of a programs, like a discounts or some things, they can use DG coupons as well for the like a wider adoption.
Okay, but that sounds very nice, and especially because here in Mexico we have a lot of patients that really need this kind of help, and well, that's very nice. But I have another important question, Srini. It sounds fantastic, but the certification, who certificate this program from Doctors Galaxy?
Sure. This is like a accreditation. We create our own framework to accredit doctors. It's a voluntary program. Doctors or any healthcare professionals are not mandatorily required to undergo this accreditation. It is their voluntary involvement if they want to get certified using our framework. What is our framework? Like example, we use a comprehensive framework that focus on the good clinical practices, patient safety, quality in care delivery, and how the clinic is being managed and how the patient is being treated versus what is the level of education the care provider is providing to the patients in the process of the care continuum. That is very important because we strongly believe the care doesn't happen only during the appointment. There should be a continuum of care where the patient should have access to the doctor or some needy resources like education, patient education, some tips or some kind of a groups where like patient groups, they can engage with each other for the sake of some moral support or something. So in that way, there are certain factors besides the good clinical practices, patient centricity, and other executive collaborations. We certify doctors according to this framework, and these are the like a best as per our framework, differentiating from the rest of the doctors.
There are two kinds of recognition: the blue and the
Go.
gold. What is the difference between them, and what's gonna be the final? Well, yes, like a payment or some kind of
Sure.
yes, a revenue. I don't know. What
Okay.
was the meaning of that?
Okay, you are asking me to summarize what is the program all about. Okay, we are going to create like a care accreditation councils for each medical specialty. So followed
Okay.
by, it is like this: one care accreditation council, which will be a jumbo in size for the primary care, where most of our accreditors, like a professional health auditors or medical auditors, quality and audit professionals, will be stationed in that council. They prepare the general framework. The specialist council, say oncology, rheumatology, dermatology, will pick up the 5 to 10 top-notch specialists from the country, and they will be a part of that respective council. So they take this primary general care council SOPs manuals and they adopt according to each medical specialty by these specialty councils. Using this framework, we certify the doctors, which is a voluntary. The doctors can register themselves to be accredited under this program. So we certify them. Once the accreditation process can take any time between 6 to 12 months. It's not that we pay and next day you get a badge or you get a certificate. No. So once they register for the program, we give them the checklist, and once they're ready for the audit process takes its time, like a 2 to 3 months. Once the doctor or a healthcare professional gets like passes through all the steps, then we issue the first thing is a blue badge. So every doctor every year, once he passes the audit, so this audit is annual. Every year it's an annual process. So every year we run the audit. So every year a doctor once qualified in the audit gets a blue badge and a certificate into their office for the display. And after 3 years, a doctor has to get 3 successive years, the blue badge. Then the 4th year, he will be awarded the gold badge. Gold badge only shows this particular healthcare professional is consistent in applying our good practices. It doesn't mean that he is giving some extra care or extra merit. No, the gold badge only shows he's consistent, because you see most of the doctors, unwillingly or willingly, I don't know, but sometimes they cannot follow all the practices throughout the life. So, but we want to ensure that doctors who consistently like pass our framework will be awarded the gold badge from the 4th year onwards. And
Okay.
these 3 years should be successive. There shouldn't be any breaks. Once the break happens, again he will be downgraded to the blue badge.
You talk about a council, a doctor to be part of this council. Who gonna test this doctor, and what do they need to accredit in terms of ethical and of course knowledge and that kind of things, because there is a concern about the ethics.
Normally, we invite the specialists. You know that we work hand in hand with most of the medical societies. We pick the top-notch specialists. We invite them. So whoever is interested to be the council members, we evaluate their CV. The first thing is he should be an active member of that society.
Okay.
Means he should have an active license and everything. CME is up to date. So no criminal history or charges.
Very important.
Plus the recommendation from fellow council members, because the council works on a collective responsibility. So example, if the remaining 4 members don't approve the 5th member to be part of the council, maybe he may not be nominated. So we want a collective and a cohesive councils to work for the betterment of the respective medical stream or specialization, so they can certify the remaining members as a with this accreditation. The other question which I couldn't, what are the benefits being part of this program?
Yes, sorry.
Yes.
Please.
So once a member is accredited, he will be shared within the group. He will be shared with all the contemporary and innovative practices. because the most senior doctors keep sharing the techniques and keep updating the framework. If a doctor is not qualified or is not following these contemporary or latest techniques, maybe he may not get that accreditation, because we don't want doctors use outdated techniques
Okay, perfect.
in the contemporary treatments. So they need to update their process and their guidelines and everything. Plus, the above all is we are going to create like a indemnity cover for the doctors. Most of the doctors may not have the indemnity cover for medical errors. Whereas under this program, we create 100 million pesos fund to cover the any eventualities of medical errors, genuine medical
Oh,
errors.
okay. Well, that's a very good
Yep.
benefit. Yes. Okay.
This is the one major benefit. And the third one is patient adcom. Okay, we understood doctors are now mostly available on the Facebook and TikTok, but now patients really don't get that. They don't feel that personal connect. Whereas we, on your behalf, I collect your patient's emails or whatever the contact form you prefer, respecting all the data privacy norms and signing all the disclosures for data privacy and protection. We
Okay.
send mails on your behalf, customized mails to your patients. So they feel more connected. And if they need, like, they feel they are in the continuum of care. And also, besides this patient education and communication, we run a disease management program, which is a common number. For example, cardiology. We run some cardiology campaigns and everywhere, all those things. Any member from the country can ask us, hey, I'm so and so, I have this condition. I want to see so and so doctor. Who can be a best one that I can access? Then, looking at the patient profile, our team of doctors in the operations team look and screen the patient profile and refer the best possible from our subscribers, from our accredited doctors. In that way, we can give a patient referrals to the doctors also. The indemnity cover, innovation, and medical education. Obviously, we have a team of medical education, and we can keep sending the medical updates, what is happening in a particular stream to you very often, like once in a week. So you not look all around the journals and need not do all those things. The snippets come to your email very often. So these are all the benefits that we are offering from this. Besides certification, you will have a stamp to prove
Well,
that there is you are the best from the rest.
very, very nice. Well, let me congratulate
Yeah.
you, Srini, and all the team, because this is well, a very nice, very strong